So I'm really able to have a good balance of work and like family life.
Sorry, Joey's screen froze, so is it okay if we record it to send it to him later so that he can
Of
go back
course.
over it?
Sure.
Um, so the next question is, how did you get this position?
Let's see. This might spill over into your next question as well. Do you mean this specific job or like becoming a physician in general?
Whichever way you want to go.
Okay.
We've kind of, I know that we both have kind of an idea of how to get into the medical field because we both want to go into the medical field.
Okay.
We'd love to hear your perspective on that too.
Okay. Sounds good. Well, I'm just trying to decide here how I want to do it. Is it okay if I go to the next question and then kind of wrap up them all into one?
Yeah, for sure.
So I became interested in medicine back in high school. My dad had a brain tumor. It was benign, meaning it wasn't really cancer, but it was still, he still had to have an operation from a brain surgeon. And so I spent some time in the hospital with him, and I was just really fascinated by how they took care of him. And so I started getting interested when I was in high school, but I wasn't sure that I really wanted to do all the additional years of training for medical school. But eventually, during college, I decided that it was a path that I wanted to take. And so my training was 4 years of undergraduate work. I got a bachelor's of science in biology. And then there was 4 years of medical school. And then after medical school, you become a doctor, but you're not really specialized yet. And you can go from there, you can go to surgery or a heart doctor or anesthesiologist. So after medical school, it was another 4 years of training to become an anesthesiologist. And I work at one of the hospitals where I trained, and I got that position because there was an opening, and I really liked all the different types. It's a wide variety of surgery and types of anesthesia that we provide, and again, coming back to really being rewarding for the teaching.
So would you have done anything differently in order to like become an anesthesiologist?
No, I don't think I would have. Yeah, I think the path that I took was good. I think the only thing I would have done differently is before even medical school, is I majored in biology, so science. I probably would have picked something other than science. You have to have certain science prerequisites to get into medical school, but you don't have to be someone that majors in biology or chemistry. You can major in art history, or if there was something that you always wanted to study, we're like, I don't know if I can get into medical school that way. No, you definitely can. So I'm not saying I would not have done biology, but I would have probably looked for if there were other options that I would have enjoyed more.
So what do you appreciate most about your organization?
I appreciate the support that I have. My boss is very supportive. He gives good feedback, affirms us, but he also allows some freedom to make our own decisions. He trusts us, so that's very much appreciated.
Mm-hmm. Is there anything that you didn't expect when you first started working there?
For the most part, no, because I did train there, so I knew what types of surgeries and anesthesia I was getting into. I guess the one thing I would say is I didn't expect how challenging it would be to work with a wide variety, like skill set of residents, because we have residents that are really good and they're obviously easy to work with, and then there's residents that are not good, meaning they're not prepared or they don't even seem to care. And that was a little hard to prepare for because I never experienced that, personally. And I didn't think other people would be like that.
Okay. Yeah, for sure. That I could see how that could be frustrating.
Yeah.
Just especially like in
Right.
classrooms. Like I get that.
Yeah, you're taking care of a patient. It's a person's life. I would think you'd want to be prepared to
Yeah.
take care of them. So,
Especially with like how much schooling it takes to get to that point.
yeah, I know. It's
That's
shocking.
crazy. What are the 3 most important skills or traits to have for a person going into this field?
I think you have to be pretty laid back, honestly, even though we're dealing with life and death every day. I think a laid back attitude and personality is probably suits an anesthesiologist better than someone who is really kind of uptight because we're dealing with life and death situations. We have to be kind of calm and make rational decisions. And if you can't handle the stress of someone's not doing well, then you're either not going to be able to treat them appropriately, or you're just going to not be able to. You may not even make it through the training. So being really laid back is super important. I think just you have to be a hard worker. I mean, anywhere in the medical field, you just have to work really hard and know that it's going to be a long process, and know that you are really delaying the gratification of having a career. My friends would finish up right after 4 years of undergrad, and then I still had an additional 8 years of training, and they're out kind of doing their own thing. And so it's like, okay, it's a long haul. I just have to know that going into it. So you have to be, I guess, kind of patient in that way, and know that you're going to be working hard for a long time. And then, we work, whether you work with a resident or you don't, you do have to be someone that's good with people. I have to be able to quickly go in and talk to a patient, and there's a lot of anxiety with patients going to have surgery and then even going off to sleep. And so you have to quickly be able to kind of relieve their anxiety if possible. Getting along with others also isn't just with the patient, but it's also with the team that's in the operating room. So there's a surgeon, there might be a surgeon's assistant, there's usually a couple nurses. And so if you have a hard time getting along with other people, then it's going to be hard to be an anesthesiologist.
So all jobs have stress. What pressures are typical for this type of job?
Well, the biggest stress is the patient's going to die. I mean, it's or I'm going to give a wrong medication, and there's going to have a bad outcome. It is, yeah. I mean, something can always go wrong, and so if you get focused on that, on what can go wrong, then you can get overwhelmed. The stress can be overwhelming. So the pressure is, I've got to put the patient asleep quickly and safely, and I have to keep them asleep, and I have to make sure that all their vital signs are appropriate, and then I need to wake them up in a safe manner. And so there are other kind of procedures that we do that are also can be overwhelming. So the main thing is just that we have a patient's life in our hands. That's the biggest stress.
What kind of education or training would you suggest for getting into this field?
I think that's a good question. Anything additional? I think if you did something related to cardiology, so if you spent time with a heart doctor, just shadowing them, I think would be helpful. I mean, shadowing for more than a day, just to understand, since the heart is kind of the life force of the of the body, and just having a better understanding of that. If you spend some time in a physiology lab, just studying how the body works, I think that would set you up for success, whether you were a doctor or certainly an anesthesiologist.
Okay. What kind of accomplishments tend to be valued and rewarded in this field?
What do you mean exactly by accomplishments?
So I know that we talked with Mr. Gillen earlier,
Uh-huh.
and he was talking about like he said, one sec, I have to go back to my notes really quick. He mentioned research and volunteering as
Okay,
like those are things that are like uplifted and looked at highly in the community.
I see. Gotcha. Um, um, Anesthesia is interesting. You can have research, but in general, there's not a lot of research that goes on with anesthesia. They have very few breakthroughs from like a drug standpoint, mainly because things are so safe now. So occasionally we do have some breakthroughs based off of research, but really by and large, there's nothing that really is all that valued specifically.
Um, what does it take to advance to the next career level? Particular skills or degree, for example?
Um, well, you've got to go from one step to the next, from undergraduate to medical school, which is a graduate school in itself. And then let me look back. What kind of educational training would you? So kind of like the skills that are important um, are just hard work. You have to be very hardworking um, to get to the next career level. To get to the next degree, to get your medical school degree, it's again hard work. I don't think you necessarily have to have a particular skill. You can outwork anybody for sure. So even if you might not be the smartest person, and I would say one of the challenges in medical school is um, people that get in medical school are obviously bright, and you're used to being typically towards the top of your class in high school. But then when you get to medical school, you realize there are a lot of really, really smart people, and some are smarter than you are. And that's okay. There can be people that are smarter than you. It's just recognizing I need to work even harder. Just because I was smart enough to get to medical school, that it doesn't end there. You have to continue to work hard to study. Um, that's kind of what I would say.
Okay, so we've done a little bit of research and we found that the entry level salary is around $115,000 a year. Does
Okay.
that fit with what you've seen?
Um, no, that's pretty low, honestly, for anesthesiologists in, I guess, is that across the nation? I'm
That was
guessing.
for Indiana that I saw.
Okay. Um, yeah, that's really low. Do you have a, is that all you need to know, or do you need to know more? Or
Yeah, that's good.
okay,
They just kind of wanted us to research and see if we could find like an entry level salary and if that met up with like what you've seen and like
gotcha.
maybe experienced in the past.
Yeah, no, that's pretty low.
So what current issues and trends in the field should we know about or be aware of?
Well, there's two big ones. One is the use of ultrasound machine. So typically, the ultrasound machine was used for pregnant women and evaluating the babies, and then it kind of switched over, and it helps us to visualize patients' nerves and arteries and things like that. And we're getting even deeper with ultrasound, how we can evaluate a patient's heart and we can evaluate their lungs. So that's been a pretty new trend, a very important one. And then the next one is we call it the care team model, or that's the best way of looking at it. Another term you may hear is mid-level providers, and there are nurse practitioners, and there are physician's assistants, and those typically have never been in anesthesia. And now those are kind of coming about, and we have this care team model, and that includes the certified nurse anesthetists who have been around for a little while, and then that recently, or at least they're gaining more traction, are the anesthesiologist assistants. They're referred to as AAs. And so this is a big topic that's been coming up on their role. And you have a question I'll speak to just whenever we come to it. It's coming up. So it's learning how to become part of this care team model, because at least in Indiana, all of the anesthesia has always been delivered by physicians. And now that is switching over, and it's been awkward for a lot of the doctors, because doctors that work in a private practice setting, like at a community hospital, aren't used to having to have somebody else do the anesthesia for them. They're like, I do the anesthesia and that's it. I do it my way. And so it's an interesting time. It's not as challenging for me because I work with residents, and so I already know that there's going to be some challenges about what I want versus what the resident's going to do. But the care team model is very important, and that's kind of where things are going. So we're all just trying to figure out how to take care of the patients the best and get along well.
What advice would you give someone who's considering this type of job? What steps would you recommend we take to enter this field?
I would definitely shadow a few anesthesiologists, kind of get a sense of what their day looks like. I think I would, again, you're in undergraduate school, I would recommend doing a physiology course, kind of like I talked about earlier. If there's a course on pharmacology, I think that's also an important course. We deal with medications every day. And so it kind of gives you a sense of, all right, this is what somebody would be dealing with. For you to get into the field, obviously you got to get through medical school first. And during medical school, you have to take a couple big exams. And they're called USMLE Step 1 and Step 2. And so you have to do well enough on these exams to be accepted into certain residency programs. And anesthesia, you have to perform not at the highest level, not at like a neurosurgery level, but you have to perform well to get into anesthesia, mainly because there are so many people that want to go into anesthesia. And I think a lot of it has to do with a lifestyle. So you just have to know going in, okay, I really have to prepare. I'm going to have to prepare well for the exams and do well on the exams.
Is there a related field you think we should consider?
Yeah, a couple of different ones. Emergency medicine, if you're wanting to become a physician, is something that is somewhat similar to our job. It's more kind of shift work based. There can be a lot of exciting times in the emergency room, just like there can be in the operating room, and then there can be times where it's it's calmer. And so you have to be able to handle the stress of somebody coming into the emergency room that's not, that's sick, or they got an automobile accident, and be okay with trying to, deal with that. Or the other one that I mentioned was the anesthesiologist assistant. I would, if you wanted to do anesthesia, but you did not want to go through all the additional years of school, you could do that.
Do you know,
Anesthesiologist, or you have a question about that?
do you know about how long the schooling is for an anesthesiologist assistant
I
compared to
do it.
an
It
anesthesiologist?
tends to be, so you do your undergraduate degree, and then it's an additional 28 months on average. It could be 24 or 28 months.
So it's like 6 years compared to like 12.
Correct.
Crazy. Okay. Is there any other fields that you think we should consider?
Um, Within medicine or just completely outside of medicine?
Either.
Um, no, I think if you have a passion for wanting to help, to do medicine, I would go through with it for sure. Um,
Can you recommend any professional associations or resources that we should be aware of?
mm, no.
Um, is there something that we didn't ask that we should consider?
I think you guys have a nice list of questions. Um, I'm trying to think back about what was important to me. Um, I guess the biggest thing would be what do you value? Like when you think about your career, what is it that I'm going to value when I'm finished? Is it money, or is it a lifestyle, certain lifestyle, or is it a certain status? And then kind of help let that guide you as while you're in undergraduate school, about where you want to go. If you want to make a lot of money, medicine actually may not be the right place for you. You might want to look into business or finance. If you want status, physician certainly has that. Being an attorney, being the head of a big business corporation, those are possibilities. So I think those are important things to just kind of decide and look into.
Um, do you have any like internship opportunities like within where you work that
Um,
we could
Not
get?
really. And COVID has really messed a lot of stuff up. When you're 18, you can come and have somebody shadow, um, which is nice. And I'd be more than happy to have you guys come and shadow and just see what we do for a day. Or it doesn't have to be a day. It can be a few hours. I've had that. I've had some students come by and just see it. But interning, yeah, it's really tricky. There's a lot of, as you can imagine, there's a lot of people that are in and out, and they want to make sure that we're taking care of patients, that patients' identities are kept confidential. And the big thing would be if you can get on the medical school campus, I think is a good start. I looked into trying to work at you know, be a helper out in like a lab. There was a lab that I was going to be helping out. They were doing, you may not like it, but they were doing tests on rats for certain things, and I was going to have to be a part of that. But at least you're getting on the medical campus. You can start getting your name in some of the research projects, because if people are doing studies on rats, they're studying something about it, and they're hoping to get their research published. And so if you're a part of that, you get your name on the research paper, which can be a big deal when you're applying to residencies, depending on the residency program that you go for. Hey, I want to do surgery. Well, what research have you been a part of? None. You've been a part of none, but Joey's been a part of, his name is on 10 different projects. All else being equal, they're probably going to lean towards Joey. And so it's nice to be able to have those early research projects available if you can. And I'll be honest, doctors are always looking for either medical students and even high school students, if it works, if they're allowed to help us gather data and interpret kind of data, because a lot of us just don't have time to do it. And so it's kind of a win-win. You know, the data gets together. You guys take care of that and help to present it for us, so that helps us. And then you guys get your name on a paper, and that, you know, further down the line can be very beneficial for you. Plus, you're around. For me, there was always a buzz being on the medical campus, where it just always felt like there's activity and there's life, and that's what I really enjoyed through medical school.
And so then our last question is, can you recommend someone else we should be talking to?
I think there was anybody else on our, just for any career, or specifically for medicine or anesthesia?
I mean, either way. I know that both Joey and I really, really want to go into medicine. Like, that's where we're heavily leaning right now, but we're both in early years of high school, so
Sure.
we can change at any moment.
Okay. Trying to think if there's some other. It's good that you talked to Dr. Jellin. That was helpful. So I'll have a good idea. Actually, his name is Scott Dean, and he's actually the senior pastor at my church, but he was going to go into medical school. And so it might be really interesting for you guys to talk to him and kind of see his thought process and how he decided about becoming a pastor, versus, because it sounded like he was, fully into wanting to do medical school. And so,
do you have a way for us to get in contact with him?
Yeah, I can send you, I'll send you his information for sure.
All right. So I think that wraps it up.
Okay.
Thank you so much for your time and
No
willingness
problem.
to let us ask you questions and pick your brain about your job.
Yeah, no problem.
All right. Thank you.
Okay. Bye-bye.